the arteries and the veins of the heart?
Okay, the arteries and the veins of the heart are going to be as follows. So you have the right coronary artery. So you look for the right heart, this side. So the right coronary artery is going to be then this artery that runs in the right coronary groove. It's running in the right coronary groove and it's going to go all the way to the posterior. So the right coronary artery from here goes all the way around to the posterior, okay, where it runs down as the posterior intraventricular artery. So you see, right coronary to the posterior to become the posterior interventricular artery. Left coronary artery is then going to be this initial branch. If this is the left heart, the initial branch here is the left coronary artery. It becomes the anterior interventricular artery right here, and then it continues posteriorly as the circumflex artery. The circumflex artery goes posteriorly. Now, in some hearts, the circumflex artery is the one that will become the posterior interventricular, but in this instance, it is ending right there. Okay. Now, in terms of veins, the first one we want to look at is the coronary sinus. All blood from the heart musculature drains into this coronary sinus. Remember, this is the left atrium, and the coronary sinus is going to be then this big vessel right there on the posterior end of the heart. And here posteriorly, you have the coronary sinus just inferior to the left atrium. Now, the coronary sinus opens into the right atrium right there. See this dark mark right here? That's one of the three vessels that open into the right atrium. Now, the great cardiac vein is going to be running with the anterior, it's going to run with the anterior interventricular artery. It's going to drain the anterior sulcus and then work its way towards the coronary sinus. Okay, the middle cardiac vein, if this is the great cardiac vein anteriorly, the middle cardiac vein is this vein posteriorly in the posterior interventricular sulcus. You see, both of them come and merge to form the coronary sinus right there. Thank you.